everybody knows, with the sequencing of the human genome, we know all the genes that exist in the normal human being. And now several cancer genomes have been sequenced, and so we have been able to see what the specific molecular defects are in the genetic material that are responsible for the development of cancer. And what's clear from all of this information is that each individual patient, each individual cancer has a slightly different set of defects and other molecular markers and changes in signaling pathways that make them more or less susceptible to a variety of treatments. We're going to have to evaluate each individual patient's tumor for a series of markers and genetic changes, and then prescribe the treatment for that person based on what those specific defects are. We already know that that's going to be likely to be more effective treatment. For one thing, it'll avoid giving drugs to people that aren't going to respond to them in the first place. And if we can get the more effective treatment on the first line of therapy, we know that the overall clinical outcome is going to be better. A good example of this already is the BATTLE trial. It's a trial in patients with advanced lung cancer where we do this molecular analysis of their tumor, and then we put them on one of 4 treatments, follow them for 8 weeks, and then see what kind of clinical response that they had. One of the findings from that study that's very interesting is that the people whose drug treatment matched well with what their molecular defects were had a better clinical outcome. So this is just the first trial. We have several more planned and some underway now, and we think this is really going to change the way cancer patients are cared for in the future. Lastly, we've had a really important series of discoveries in our what we call our Phase 1 program. These are the earliest phases of trying new treatments on patients with cancer, in this case mostly advanced cancers. And what we found is that when we apply this personalized therapy approach to determining which defects are present in these patients, in their tumors, and one of these is the PI3 kinase pathway, if we match the drug treatment to that particular defect in the Phase 1 program, we get about a 40% response. That means that the tumor actually shrunk or stopped growing in those patients. And this is much, much better results than anybody's ever been able to achieve in a Phase 1 study, which usually is just looking at toxicity of drugs. And here we're finding tremendous responses very, very late in the progression of these patients, which is I think going to change the way we think about treating patients with advanced diseases.